Ladies and gentlemen, welcome aboard the Pilot Lawyer Podcast. Thank you for your attention while this important legal information is reviewed. What you hear should not replace consultation with an attorney and should not be considered advice for your situation. On behalf of the Pilot Lawyer and your entire crew, it's our pleasure to have you aboard.
Welcome, aviators, to the Pilot Lawyer Podcast with us, the Ison brothers, at the Ison Law Firm, where aviation law is all we do, nothing else. You're here for what we do best, navigating the FAA medical certification process for pilots and those who want to become pilots. And of course, if you don't laugh, you cry, and for the next 30 minutes, we hope to bring you the lighter side of what can otherwise be a frustrating process. So whether you're laughing at us or with us, join us, brothers, as we discuss the fascinating world of FAA medical certification. Join us today with our Christmas special, where we'll be discussing FAA medical certification with kidney stones.
Why is this the Christmas special?
Just because it's Christmas time when we record this.
So we're going to go ahead and own Christmas.
We're owning Christmas.
All right.
Go ahead and put up the wreath, Alex.
I don't even know what to say to that.
So today we are going to be talking about FAA medical certification with kidney stones.
Kidney stones. You know, I recently thought I was having a kidney stone. Turned out it was appendicitis.
You know, I recently thought that I was having a stroke or something, but it turns out it was Alex throwing a bottle of Excedrin at me that I didn't realize. It hit me in the face just moments before we started recording this podcast. And it feels as though the left side of my face is swollen to over 3 times its size.
Couldn't have been hit by anything better, though, to fix the problem.
Right?
Yeah.
Maybe some ibuprofen, though, to reduce the swelling, but
Sure.
overall. And
Well.
3 times the size, don't get a big head.
Well, it's
Okay,
finally
not that big.
matching the level of the amount of chins I have. So 3 times the face, 3 times the chins.
That's the size of a face I'd put with those number of chins.
So kidney stones, can you get one or not?
Well, you can definitely get a kidney stone.
Absolutely.
Now, that's the thing. You know, I drink a lot of Diet Pepsi.
And very little water.
Very little water.
Coupled with a lack of exercise, you're a recipe for a kidney stone.
Well, you know what's interesting? I broke down, drank a bottle of water yesterday.
How'd you feel?
I mean, things were happening in my body I hadn't felt in 15 years. The interesting thing about it is, though, you know, every now and then I'll just be wondering, you know, when's that kidney stone going to happen? And that's the scary part about it. They're random.
Yeah, I don't like random.
Yeah, it's random.
Well, that was
At least with a heart attack.
Appendicitis.
With a heart attack, I know, hey, probably once I hit 60, take me now, Lord.
But that could come a little bit sooner than
That's true.
surprise.
Yeah. So, but you had
45th
appendicitis.
birthday.
You had appendicitis.
That's what they
Recently.
told me. That's what they said I had it, and they did something because of that. I don't know. I never
I know
saw
what that
it.
Don't
means.
have no more.
So you think they maybe...
I never saw the appendix.
So they didn't give it to you in a jar?
No.
They didn't
That's
show it to you?
unfortunate.
No. Hey, listen, if they gave that thing to me in a jar, you know it'd be sitting on my desk.
That's the sad part.
Just me and my appendix.
Now I got parts of me scattered to the wind. I don't even know where they're at.
Yeah. You could be
Incinerated.
the part with all the knowledge.
You could almost do a kind of like maybe some kind of like
Mythbusters.
novel. No, do like some kind of John Grisham novel or something where somebody has, you know, surgery, they have something removed, and then they use it to plant them at the scene of a crime. And
Yeah,
this guy robbed a bank and left behind his appendix.
Don't be saying it here because people are going to take your idea and run with it. And
Well,
you heard it here first.
We got it published here, so
Well, true.
They're going to
I
go
got a
find your
timestamp.
appendix and they're going to plant it someplace.
Well, good luck. I don't even know what's that.
Not much going on with it.
All right, anyhow.
So
back to
anyhow,
the
my
kidney
face
stone.
is now 4 times swollen because Alex is
Impeccable aim.
Yeah.
Anyhow,
So,
I
kidney
mean-
stones. Can you get one? Yes.
Yes.
But here's the
Well,
thing.
can you get one? What?
Can you get a medical?
Yeah.
Yeah.
And you can get a kidney stone.
You're asking that as if, can I get a kidney stone?
Sure.
Probably not.
I don't know with that one kidney you have. But kidney stones, yes, you can get a medical certificate. And this brings us back to the khaki program.
Conditions AMEs can
issue. That's right. Can is the optimal word there.
will.
It's not will. It's not definitely have
Must.
to. Or your AME is going to issue it. So, congratulations. It's conditions AMEs can issue. So let's talk about what do you have to do to get them to want to issue it?
Right, you got to get them out of the can first.
Yeah. So talk to us about it, Christopher. Give me some thoughts.
Well, here's probably maybe one of the more simple circumstances that we could go over as far as people having a history of kidney stones and applying for a medical certificate with the FAA. A situation where the individual has a kidney stone event that occurred more than 5 years ago from the date of application. So in those cases, the FAA has authorized the aviation medical examiners to issue a FAA medical certificate to the applicant so long as there are no ongoing symptoms or current problems despite that previous history of kidney stones.
So if I have a retained stone, let's say I had a kidney stone 5 years ago plus, and I have a retained stone, I'm not falling into this category.
Not in this
This is a situation where if I had a stone,
Passed it.
I was a rolling stone, right? It passed the stone.
Sounds painful.
Yeah, I passed the stone 5 years ago, or 5+ years ago, and I walk into the AME's office and say, hey, listen, I have no ongoing problems. Prove it relative to my kidneys, and I have no current problems or symptoms, if you will. I'm not having, side pain or whatever. I'm not having trouble urinating, so on. The AME can just issue it, and that's not a khaki problem. That's not something where I'm going to have to produce a letter from my doctor every time I go. I'm not going to be dealing with this.
Should you go in there, though, armed with?
Yes. Armed.
I'm sorry to take the wind out of your sails.
Yeah, well, I will be armed. I'm not
We should have done a thing on migraines because of you getting hit by the migraine medication.
Oh, man. Well, forget that I got hit. We'll act as though it happened again on the next one. But what were we talking about before you just changed
We were
the
talking
subject?
about going in armed with medical
document-
records.
Right.
Yeah.
So we'll kind of back up slightly. On the MedExpress, right, you're going to identify question 18J.
J.
Now, K is diabetes. Question 18J, kidney stone or blood in the urine. So just to kind of reiterate what we said before, on the MedExpress, it asks in all caps, grandma style, have you ever in your life been diagnosed with, had, or do you presently have any of the following? So if I had a kidney stone 26 and a half years ago, I'm going to say yes to 18J, kidney stone or blood and urine. Now note that it's not kidney stones. It's not a situation where you have had to have had multiple. If you have one microscopic stone in your lifetime, you're saying yes to 18J. So you'll say yes to 18J, and our recommendation would be that if this is the first time you're applying for a medical certificate, having reported your kidney stone, what would be prudent of you is to produce a letter from your treating physician or your regular primary care doctor. You don't necessarily have to go to a urologist or nephrologist. You can essentially just go to your primary care doctor, if you have one, and have them generate a detailed clinical progress note to identify that exactly what they've asked for here in the FAA guidelines relative to kidney stones that have passed more than 5 years ago. You want to sort of identify that whether or not there are any ongoing symptoms, whether or not you're having any problems currently relative to kidney stones or kidney function, and whether or not there's any indication for a CT scan or what they call a KUB. I would say that probably your doctor, if you come in and you've never talked to the doctor about kidney stones because your kidney stone occurred 50 years ago when you lived in Keokuk, Iowa, and you're now in Everglades City, Florida, it's going to be a situation.
Man, quite the downfall.
I think that's probably the only time those two places have been put together.
Well, here they are. Keokuk isn't what it used to be. So now I'm in Everglades City. I've got this new primary care physician. I've never spoke to this individual, this doctor, about my history of kidney stone because I had any more kidney stone. That doctor is more inclined, though, I think at that point to say, hey, well, listen, Sonny, I don't know anything about you. I've never seen your kidneys before, so I'm going to have to go ahead and get a CT scan or a KUB. I'm going to need to sort of ascertain whether or not you really are doing well. Do you really have a kidney stone that's still lodged in there, right? So there's a good chance that you might have to have some imaging done to produce a letter to take with you to your AME, even if it's been 5 years plus. Now, let me say one more thing before I get rude.
Babble much?
Yeah. Well, here's the thing. you could probably go to your AME. You could probably say, hey, I had a kidney stone 25 years ago. I'm not having any problems. There's a good chance that the AME would issue the certificate without documentation required, the KUB or otherwise. My impression is that it's probably not wise to do it that way, just kind of chance it, because there's a chance you get deferred. And once you get deferred, you're waiting months on end for the FAA to issue a medical certificate when you could have otherwise been issued in the office by your AME if you were otherwise qualified.
Well, let's talk about these here real quick then.
Well, let me say one more last thing.
There's more to talk about.
Well, I'm still talking about these people with the 5+ years. The benefit of maybe getting the letter, maybe not entirely required, is that the letter is going to also help stave off the FAA downward. So even if your AME issues the medical, that doesn't mean they can't turn around and say, well, hey, listen here. We understand that you had a kidney stone 5 years ago, but we need to see proof in the pudding that you're doing all right now. And so having that letter, maybe that KUB, would help stave off the FAA following up even on an issued medical. So now you can talk.
Well, what I was trying to ascertain on that diatribe was we're talking about more than 5 years ago with a retained or a non-retained stone. Doesn't matter.
Non-retained.
So you've passed it.
I passed the stone. Remember I made the Rolling Stone joke?
I understand, but if it's been more than 5 years, but you had a retained stone, what happened?
Oh, you still have the retained stone? It's still retaining it?
You retained it. You've just been taking it around with you.
You're sort of in the same spot as you were a moment ago when I would say you're going to need to go and get a letter from your doctor identifying these facts, right? That you're doing well. You don't have, well, I guess if you have a retained stone, you have a retained stone, but then sort of ascertaining, what are your symptoms? What are the odds of an incapacitating event? Are you going to have any surgeries? Have you had any surgeries? Have there any complications?
Asymptomatic?
Is it asymptomatic?
Stable?
Is it stable? Right? And that's where you're going to end up in a spot where your doctor's probably going to want that KUB or any other imaging to sort of ascertain how that retained stone is looking, right? So KUB is a kidney, ureter, and bladder x-ray, just for those who don't know what that stands for.
What if it's within the last 5 years? Let's say, because everything we've been talking about has been outside of 5 years, right? Let's say it's within the last 5 years, but you passed the stone. What happens there?
Yeah, if it's within the past 5 years, and there are no retained stones, I would say do the same thing, right? Go get a letter from your doctor, show them that there's no retained stones and that there's no issues. The FAA at that point, is inclined to say, well, hey, listen, put you on a khaki perhaps for a period of time. But if you don't have any retained stones, no recurrence of symptoms within that 5 years, it's a good argument to say to the FAA, hey, listen, just warn this airman. Say, hey, if you ever have any symptoms again or any problems again, let us know.
What about situations where there's maybe more complicated situations where the condition is symptomatic or there is an underlying cause for recurrent kidney stones? Like maybe the person keeps getting kidney stones on a frequent basis, once every 2 or 3 years or something like that. Random.
Has your FAA medical certificate been denied? Are you concerned you may not be able to get a medical certificate from the FAA? Are you at risk for FAA action for failing to report your medical history appropriately? Call the pilot lawyer at 1-855-FAA-1215 to discuss your options for getting the FAA to issue your medical certificate and get you flying. We are happy to evaluate your case and discuss with you a plan for presenting your case to the AME or the FAA. Aviation law is all we do, nothing else.
So we're running into a spot now where the airman's going to get deferred by the AME. So if you have a situation where you're having complications, you're having symptomatic issues, there's an underlying cause for recurrent stones that needs to be addressed, the FAA is going to want, again, another letter from your doctor, a detailed clinical progress note that's authored within 90 days of your visit with the AME. If there's an underlying cause causing the kidney stones, they're going to want information on that. What is the diagnosis? What's the treatment plan for that? Are you taking any disqualifying medications for the underlying condition? What medications are you taking? Are there any side effects? If there's been surgery to try and treat the kidney stone, we want operative notes from that. And if there's been any imaging, they're going to want to see the actual imaging, sort of assess what's going on with these retained stones or the history of the kidney stone. And that is something that likely you'll be issued a special issuance. Now, again, the difference between a special issuance and a CACI is something where the FAA has said, hey, if you meet these certain criteria, AME can just issue your medical certificate. The special issuance, though, is at the federal air surgeon's discretion. Their thought process is, hey, you don't meet criteria for a medical certificate in light of your history of the kidney stone, or perhaps a retained stone, or a complication relative to your kidney stone, but we're willing to give you one anyways if you provide us regular, updated information relative to your current status and so on. So a special issuance for a kidney stone would maybe be, again, every year or maybe every application, we're going to want this detailed clinical progress note from your doctor and a KUB and so on.
What if you're like me? You've been going along fat, dumb, and happy.
Mostly fat and dumb.
That's true. Just pencil whipping your applications. No. All the items in Section 18, And then you go see your AME, get a medical, you're out there flying, and then, 6 months later, you realize, oh man, I forgot to put down that I had a history of kidney stones on the application. Should I just wait till the next medical to report that history of kidney stones? Or should I do something in the in-between?
So definitely if...
Wait. What's that, Scalix?
I'd say you probably do an amendment.
Okay, now answer, Anthony.
So you're going to want to do an amendment. So essentially what we would do is you'd want to go to the FAA and say, hey, listen, I want to tell you about this kidney stone that I failed to report. Sorry about that. And at the same time, you'd want to try to provide documentation from your treating physician or a doctor identifying that, hey, listen, this airman's doing fine, or if they have a retained stone, it's not something that's symptomatic and so on and so forth, to try and establish your medical eligibility at the same time. So in other words, you want to go to the FAA and say, hey, listen, I've got this, but I'm okay, and here's documentation to establish that point.
If you have to do an amendment, right? So the amendment would be done before your next application. And there's a reason why we would recommend that you do an amendment before you just go do it, put it on your next application, right? Mm-hmm. And that is because if you do it on the next application and they come back and ask for the medical records and they'll say, oh, well, you had this history at the time of the previous application, you didn't report it. Now you've kind of essentially ratted yourself out and admitted that you falsified the past applications without having taken any actions to correct it, right?
That's right. So that's the myth of the AMEs. The AMEs, just put it on your next application.
Yeah.
But the thing about legally, the idea there is that, okay, you're providing a correct response to this application, but you're not doing anything to fix the old applications. And so if I were in a position where I was having to defend an airman relative to a falsification question, my concern would be, if we had a written document from the airman saying, hey, I want to fix these applications, that's something that's more defensible, right? I can go to the judge and say, hey, listen, the FAA wouldn't have known about this but for the airman reporting it and outwardly trying to fix these old applications. Versus if I just put on the new application, I don't have anything there to have, judge, they put the right answer down in the application. I don't have anything to fix the old applications based off of that per se.
Well, if you do an amendment, reporting your history of kidney stones, should you self-ground until the FAA comes back and says you're good to go? Doing the amendment, does that immediately revoke or suspend or deny your past application or your medical application? Where does that leave you and your ability to exercise the privileges of your airman certificates vis-a-vis having a valid medical?
Yeah, so your medical certificate is still accurate.
Accurate?
Is still accurate.
That's inaccurate.
It's still validly issued, right? It's not going to, maybe it's not validly issued, but it's been issued, right? It's not been suspended, denied, or revoked, or canceled, or anything like that. So your medical is still good, technically, but you're eligible only to the extent that you are considering the self-grounding regulation of 14 CFR 61.53. which essentially states if you know or have reason to know of a medical deficiency, you should self-ground. So that's something you always have to make a self-assessment on, even though your medical certificate hasn't been revoked. If you can do a self-assessment to say, hey, listen, I'm doing just fine, blah, 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 that's something that you can kind of...
You'll have to make that decision. Typically, we won't tell people whether or not under 6153 they're good to go because it's a self-assessment, and we're not yourself. So
we aren't. We're not even ourselves. Now let me back up, though, to the complication. Complications that would require a special issuance, the FAA identifies as the following. So hydronephrosis or chronic or essentially... Alex, why don't you tell us what that is? Do you even know?
Hydra for nuts.
No. You don't even know the word.
Yeah, hydra.
Well, essentially what it is excess fluid in a kidney due to a backup of urine.
Okay, I can see that.
Backup of urine. So then you have metabolic underlying conditions requiring treatment, surveillance, or monitoring. So you have underlying conditions that are causing the kidney stones that will need to be monitored. If you've had more than 3 or more procedures for kidney stones within the last 5 years, right? So if you're really spending some time getting some procedures done, the FAA's thought process there is that, hey, this might not be as stable as we'd like for it to be. This person's having to have multiple procedures. So they'll put that on a special issuance, assuming you satisfy the renal failure or obstruction, acute or chronic. So if you're having situations where there's a obstruction, you're signaling to me like that's stupid that I would try to expound upon that.
No, it's just a guy out here mowing.
Yeah, there's a guy mowing.
It's annoying.
Sepsis or recurrent urinary tract infections due to stones. So there's that. Now, let me say this much. The FAA does make a point to say that metabolic evaluations and imaging should be performed as clinically indicated by the treating physician. And the acceptable imaging includes the KUB, which we discussed, an ultrasound, an IVP, or CT or MRI as clinically appropriate per the treating physician. Most of the time, we see the KUB being the acceptable diagnostic imaging. So there's that. Now, let me ask you a question, Alex.
Oh, boy.
If I was having a kidney stone, what is that?
What is what? The actual process
what is a kidney stone?
So it's calcium deposits that collect within the kidney that form a stone. As fluid is moving through and being filtered through the kidneys, gets stuck in, whether either in the actual kidney itself and blocks that flow outward to the ureter and ultimately the bladder. And yeah, that's it.
Interesting.
Can it get stuck somewhere else other than the kidney?
The ureter, like I just said, which is the tube that goes between the kidney and the bladder.
Is that the urinary tract?
It's part of the tract, yes, sir.
Let me tell you about this. Now, you can find this in the National Library of Medicine, PubMed, Advanced User Guide. The incidence of urolithiasis. The incidence of kidney stones among commercial aviation pilots by Elias S. Hayams et al. They all have the last name of et al.
They all must be related.
Yeah. In this article, the purpose was a kidney stone event in a commercial aviation pilot has significant vocational implications since the FAA specifically prohibits medical certification in the setting of recent or recurrent stone disease. Now, that's something that I disagree with in that article. Again, we've just talked about the CACI program and so on. Given these serious concerns, an understanding of the burden of stone disease on the commercial aviation community is important. Thus, they performed a study in partnership with the FAA to better characterize the epidemiology of the condition. So, in this case, they reviewed FAA medical certification database for 7 years, pilots with a first-class medical certificate. And they were all reviewed, and all medical certificates submitted with a pathology code of 573 kidney stones were identified for analysis. In this study, from 2000 to 2007, between 3.7 and 4.6 of what they called scheduled commercial aviation pilots were diagnosed with urolithiasis, kidney stones.
That's not a town in Europe anymore, is it?
Not anymore, near Keokuk, Iowa. However, during the study period, there was a significant decrease in the proportion of pilots diagnosed with kidney stones. The conclusion was that a meaningful number of commercial aviation pilots are affected by kidney stones each year. Their analysis detected a significant decrease in the proportion of affected pilots, although the reason for this trend was not well understood.
Is it just because they're not reporting it?
Perhaps could be. It says it may be that changes in the occupational environment that could affect risk factors for stone formation are responsible. Just seems kind of odd. Further efforts to characterize
drinking
stone
more
risk,
water.
Yeah. Further efforts to characterize stone risk in the unique population are welcome, given the larger vocational societal consequences of a stone event in the setting of airline transport. So essentially what they're getting at is there is a relatively small portion of individual with kidney stones per this article, but it is something that is studied and is of concern.
In general, when we've had clients in the past that have had kidney stones or history of kidney stones, and this is always a difficult question to answer, percentages of success, but generally, are they likely to get a medical, or have there ever been incidents where they've had kidney stones and they're not getting a medical? What do you typically see there with that?
Yep. So my perception here is that most people with a kidney stone are going to be issued a medical certificate. The question is, are there folks that are going to get deferred and end up having a special issuance? Sure, but those are fairly far and few between. So in most cases, you'll end up with a khaki, and if you have the documentation in place to support issuance, you'll be gold as a goose.
And if you need help getting all that documentation in place,
there are many aviation medical services out there. There's some great ones.
Ison Law Firm.
That's the number one.
Comes to mind. Call them first.
Yeah,
and
last. Right. I was just joking about there being other great ones.
Alrighty.
All right. Well, I think we're flaming out here.
Yep.
And
coming in quick under that runway.
Yeah, that's right. So you've wasted another. Where's that sheet? I'm just going ad-libbing. You've logged another uneventful half hour listening to the Pilot Lawyer podcast. And even though the lawnmowers love to mow right by our window, we're still the Ison brothers of the Ison Law Firm. You like that one?
Let's get us out of here.
Just turn it off.
This is thepodcastfactory.com.